Let's bring in emergency doctor and president of Victory Health, Dr. Kelly Victory, and chief medical advisor for Truth for Health Foundation, Dr. Peter McCullough. Thank you so much for joining us. You know, can we roll this? I just want to set this up because when I saw this the other day, I was just blown away about what Fauci said about what this is really, it's really all been about. Let's go. Can we take a listen to that soundbite, the Fauci? Let's go.
It's less about mandates on the plane than it is about who has the right and the authority and the capability of making public health decisions. And I believe that the Department of Justice is operating on the principle that decisions that are public health decisions belong with the public health agency, in this case, the CDC.
So, Dr. McCullough, Fauci just said the quiet part out loud. He just admitted this was about control. And furthermore, he noted that the Department of Justice should oversee our medical decisions, oversee the CDC. What are your thoughts on this?
The CDC is merely an advisory group. They do research, they do outbreak investigation, they provide data to physicians as well as data to the consuming public. But the CDC is a recommending agency. It's up to individual businesses, individual jurisdictions to make their own public health decisions. What he's doing is he's trying to intentionally shift power to the CDC.
Kelly, Dr. Kelly, in this whole idea of we were mandating masks, we were mandating vaccines and boosters, well, we were just trying to see how much control we could get. This is what we've been talking about for 2 years.
This has been a massive power grab all across the board. Not only the CDC, but the FDA, drug companies, various and sundry politicians, certainly the governors of multiple states have used this. They co-opted the pandemic. I'm not saying the virus wasn't real. It was real, and it did pose a risk to a certain group of people, not the vast majority of the population, however. And they co-opted this pandemic. They instilled fear across the board. They applied mandates with a broad stroke, acting as if everyone was at equivalent risk, when we knew from the very beginning that only a small subset of the population actually was at risk. No one needed to stay at home other than those who were in those risk categories. So instead, they left a smoldering crater where our economy used to be. They instilled fear across the board. They robbed children of 2+ years of their education. They have many people still cowering in their basements, believing against all science that masks do anything to stop the spread of respiratory viruses. They have people believing that these vaccines have been tested and are safe and effective, neither of which are true. And it has been all about a power grab.
You know, and Dr. Pete, we're all about separating church and state, right? We don't want the state to tell our churches what they can and can't do, what they can and can't say. And for me, this whole idea that the Department of Justice has some sort of, I don't know, some sort of say in what doctors like you and Dr. Victory are telling us and what we should and shouldn't be doing. That is dystopian and Orwellian in itself, I would say. Would you agree with that?
I agree. There's a great opportunity for public harm and misadventure. We know that when there's an overreach of various branches, in this case, the judicial branch of the federal government, the interfering with something as local and as personal as healthcare. Healthcare is always between the patient, the doctor, and the care team. All these other stakeholders, the NIH, CDC, FDA, DOJ, executive branch, they can provide advice. They should be helping us, not hurting us. Instead, what we've seen actually across the entire world and through now governments is we've seen through a healthcare crisis an attempt to gain power and control.
And final thought, Dr. Kelly, there was another round of Omicron variant. A lot of people got sick again, and all of a sudden you're hearing rumblings of masks again, and a couple of states saying maybe we're going to go back to that. Are we done? Have we finished this pandemic?
This pandemic has been over for a long time. It is endemic. The virus is endemic, meaning it isn't going away. It has done precisely what we would have anticipated for a virus. It has mutated to a form that is more contagious but less virulent. It causes very, very mild symptoms in the vast majority of people. It is here to stay. We better learn to live with it. The idea that they're going to double back to masks, social distancing, limiting, the capacity at gatherings is insanity. There's absolutely not a shred of scientific evidence that ever worked or was ever necessary.
Yeah. All right, guys. So glad to have you on. By the way, doctor, just anecdotally, a lot of friends, a lot of family, and my personal doctor says he's seeing a lot of people with that Omicron variant, and they're getting a cold on the backside of that.
Right.
So, and that really was more of the symptoms than what the actual Omicron variant was giving them. So, just an anecdotal thought there. Dr. Kelly Victory and Dr. Peter McCullough, thank you both for your time.
Thanks for having me.